Brilliant. So welcome everybody. Thank you for joining us today. On behalf of NUS Pharmaceutical Society, the International Pharmaceutical Students Federation and the International Federation of Medical Students Association, GCI Health and Sanofi, welcome to day zero of the 2020 Beyond Health Hack. My name is Dan Blomfield. I work for GCI Health, a communications company that's supporting the event today. I will be the MC for today's session. We've got a packed agenda. Hopefully everyone can see me clearly on the screen and hear me. If you have any trouble at all at any point, there is a chat function on the right hand of the screen. Please pop a message in there and the team will be able to help. So in terms of kicking things off, this is a really exciting session and we're really glad that you're able to join us today. We will be going through a lot of the background to why we're here and the importance of the session and the importance of fighting the preventable burden of influenza. There are some informative sessions and some technical sessions, and we'll go through all of that, and we will be here to answer any questions as we go through. So please use that chat function. In terms of running order, I will hand over shortly to Ada Wong, Asia Pacific Affairs Lead for Sanofi, and we will start the session. So hopefully everyone can hear us, and over to you, Ada.
Thank you, Dan. Hi, good morning and good evening, everyone. I'm Ada Wong. I'm Asia Public Affairs for Sanofi. I'm delighted to join each and every one of you here today. At Sanofi, we're very proud to support the National University of Singapore's Pharmaceutical Society in such an impactful initiative that is beyond health hack. COVID-19 has an impact on all of us around the world in ways that we did not even begin to imagine. At the same time, COVID-19 has also forced us to innovate and innovate fast. Although we're not able to meet in person for this hackathon, the fact that we have been able to adapt to a virtual environment is fitting for this innovative nature of the event, and now need to be socially distant for the foreseeable future. As COVID-19 continues to spread around the world in second waves, this hackathon is more important than ever. The need to innovate for protection against infectious disease goes well beyond our current pandemic environment. As you know, our objective for the hack is to ideate a future where the preventable burden of influenza is a thing of the past. To reintroduce how much that goals matter and remind you of what we are working to achieve via the hack, I'm going to play you a very short video that some of you may have seen during the registrations process.
Beyond Health Hack is bringing together pharmaceutical and medical students from over 18 countries on a virtual platform to solve unique challenges that stand in the way of flu vaccine uptake. All around Asia Pacific, influenza is disrupting lives and economies. There are many challenges in the way of improved vaccine uptake, including poor awareness of the need and pharmacists not authorized to vaccinate in Asia. So how can we help? Beyond Health Hack is our opportunity to bring the brightest minds together to workshop innovative approaches to influenza vaccine uptake. As future healthcare professionals, you will play an important part in preventing influenza. We want you to join us and be part of this amazing opportunity to create real change. Will you accept the challenge to create a future where the preventable burden of influenza is a thing of the past?
Okay, with over 200 participants joining us from 12 countries across Asia Pacific, and a team of experts ranging from infectious disease specialists, health economists, industry leaders, and academia. We're certain that at the end of our virtual healthcare journey, we have many powerful ideas to address many barriers to the preventable burden of influenza. and especially vaccine awareness and uptake. Over the course of the next 2 weeks and the 2 days of the actual hackathon, all our mentors will be with us to guide and support your brainstorming, provide feedback, and help shape the presentation of your powerful ideas. The hackathon and the virtual collaboration is a venue for us to learn and innovate together. We hope it will be a powerful opportunity for all of us to discuss the real-life solutions that in preventing influenza and reducing its risk, and to actively communicate our ideas with all stakeholders in the healthcare system around the region. As present and future healthcare leaders, you all have a critical role to play in the journey of influenza burden reduction. All of us from the Beyond Health Hack organizing team are so glad to have you on board. Welcome. I will also take the opportunity to thank you, our steering committee members, mentors, and organizing committees, especially the National University of Singapore Pharmaceutical Society, International Federation of Medical Student Association, International Pharmaceutical Student Federation, and GCI Health. Thank you once again. We look forward to having you all for this event. Have a great discussion, and most importantly, have fun. I will now hand over to Dan to take you through the program overview.
Brilliant. Thank you, Ada, very much. So I'll now go through what we will cover in today's session. So we will kick off by looking at some of the program milestones, what to look forward to over the next couple of weeks. I will introduce our fantastic jury and mentors. We're really honored to have such a broad and deep experience mix with everyone that's supporting this. We will look at the burden of influenza, as well as some hacking frameworks and tools and some really useful information for you all when you are going into the hack sessions themselves. We will look at the platform that we're on, some of the things to think about in terms of how the sessions will work and how you in your group can work together and collaborate. We'll also have a fantastic key information session with Dr. Papastudiou. And we will then finish off by the presentation of the challenge and the allocation of the problem statements. So in terms of the milestones, so today we are day 0. This is the information and briefing session. This is where we will look through the background and the importance of what we're here to tackle. Then in terms of the hack itself, this will kick off on the 7th of August. This is the main session. This is the session where we will provide an introduction and the rules of the hack itself. Then in your groups, you will participate in the hacking discussion. There will be a preliminary round of presentations, and these will be split into 5-minute pitches with some Q&A as well. And then following that, based on the judging criteria that I'll discuss shortly, the winning teams will progress to day 2. The focus of day 1 is all about a root cause analysis. It's really uncovering the challenge and the background to the problem statement itself. Day 2 will be all about the solution. And based on your presentation of the root cause analysis, you will then take that challenge and move that into a solution phase. There will be a similar style of presentation with 5-minute pitches and Q&A. And then afterwards, there'll also be a networking session as well. So you will have the opportunity to discuss with the broader team, as well as all our fantastic judges and mentors. And then following that will be the exciting moment of announcing the winning team and the prize presentation. So the timings are on the screen, and we're really excited to support you today in terms of making sure you're informed and prepared for these 2 really exciting days of hacking. In terms of the judging criteria, so as I mentioned, so day 1 is all about uncovering the background to your problem statement. So you will have a particular problem statement that you are there to uncover. And really what the judges will be looking for on this day 1 is your understanding of the barrier analysis, the evaluation of the events and the factors that go into the challenge itself. And it's really getting into the understanding of the problem. Then in terms of your presentation and how that will be judged, it's about the effectiveness and the analysis of the situation, what sort of resources and communication challenges you've uncovered, and a real deep dive into the challenge. And then, of course, this is a presentation, so making sure that the team that present is clear and concise, there's appropriate referencing, and also there's an element of creativity in there as well. And so from this, everyone is judged on the same framework, and the winning teams from this day one go through to day two. On the second day, so this is where, as I mentioned, from the root cause analysis and really uncovering the challenge, the solution is developed. And from this, the judges will be looking at creativity. Have you come up with a unique and innovative proposal for how to beat this challenge and how to uncover this insight? Is it effective? How have the objectives been understood, and how will you measure the success? How will it be implemented? We're obviously looking for a solution that can be implemented, and this is a practical solution that could be rolled out in the real world. Sustainability and scalability is absolutely critical. So how have you thought about how the program or the solution can be sustained and scaled up in the long term? And of course, the same components of the presentation itself, making sure it's effective, it's clear, it's concise, and your delivery and your creativity is fantastic. The judges will be marking this and scoring this in real time online, and so we'll be able to progress to the awards announcements rapidly. Okay, well, it's my absolute pleasure to introduce our jury and also our mentors. So we are really honoured that so many industry and academic professionals have volunteered their time to support this program, and it's a real testament to the importance of what we're doing here and how this burden of influenza can be prevented with the fantastic minds that we have on the call today. So I will quickly run through who our jury are. So we have Miss Audrey Clarissa from AYPG. We have Dr. Camilla Wong from the Ministry of Health, Mr. Chris Hardesty from KPMG, Dr. Liu from the Ministry of Health, Dr. Yotti from National University Hospital, Mr. Lim from the Federation of Asian Pharmaceutical Association, Dr. Yor from Holmusk, Dr. Papastogiou from the University of Toronto, Dr. Gandhi from Gyanpati Limited, Associate Professor Lam from NUS, Dr. Pung from DCH Auguria, and Mr. Sampson from the Australian Immunisation Coalition. And this is, we're really honoured to have such an esteemed jury. And as we go through this, you will have plenty of time through the session, and especially on the hack days, to interact with these experts and to provide a dialogue and to really learn from them. We also have an even bigger group of mentors, and we're again really honoured that so many esteemed professionals have been able to support us with this program. Your mentors will be available throughout the hack sessions, and you will be they will be assigned to various groups, and they are there to support you. Everyone here within our group of mentors are professionals and have a lot of real world experience, and they are there to be tapped into and support you and guide you as you go through. So very quickly, just there's a lot of them, so I will hopefully do them justice by quickly introducing them. We have Dr. Hamid, we have Professor Chunara, Mr. Posadas, Dr. Ng, Mr. Fayaz, Ms. Yong, Mr. Yin, Ms. Tan, Dr. Sindala, Associate Professor Lehun, Ms. Tio, Dr. Jiang, Dr. Stibic, Mr. Tan, Dr. Venkatachalam, Dr. Hafei, Ms. Tia, Ms. Lim, Mr. Leung, Dr. O, Dr. Teng, Dr. Lin, Mr. Acosta Gomez, Miss Ling, Dr. Sessions, and our fantastic NUSPS team. So thank you, mentors. Thank you, jury. We're really honoured and privileged to have you all here. Everyone on the participation groups will be able to interact with you, and thank you again for your kind support of this program. Now, of course, behind this fantastic program is a lot of hard work and a lot of people who have come together to bring this to life. Our main organising committee is NUSPS. I'll quickly introduce them, and then I'll hand over to Matthew to just give a quick introduction. So, from the NUSPS team, we have Matthew, Rustam, Alison, Qixiang, Jebel, Xiaojie, Yun, Junqi, Hulian, Qihuang, Abdul, Jasmine, and Alicia. So thank you, team. You are fantastic. I'll just hand over to Matthew very quickly, just to say a few words on behalf of the NUSPS team. We'll just make you a presenter, Matthew, so you can speak. Hopefully you're able to say a few words, Matthew. Okay, well, I will...
Hi, can you guys hear me? Is it all good? Hi. Everything good? Can you guys hear me?
Yes, we can hear you. Yeah.
Okay, that's great. So I just like to say welcome to the Health Hack. My name is Matthew. I'm the project director from NUSPS who brought together the student team that organized this event as a whole. I'm sure everyone's excited to be here, just as we are all excited to have you here. I'd like to especially thank our mentors and judging teams for volunteering their time to help guide the next generation of healthcare leaders. And I'd like to wish our participants and hope that you guys all have a fun and enriching experience. So best of luck to all the teams, and we look forward to hearing all your wonderful ideas.
Okay. Thank you, Matthew. Brilliant. So I'm sure you can appreciate we have a huge number of people behind the scenes. We have a fantastic group of mentors, and we have an amazing jury who are here to support the program and to support you. But we are here for one main region, and that is to ultimately pledge to fight flu. And we would ask you to join us in this pledge by sharing the hashtag Pledge to Fight Flu. This is a really important topic, and it really brings us all together in what we're here to achieve. Annual flu vaccination, is the first and most important thing to protect against influenza and avoid spreading it to others, including patients, co-workers, and loved ones. Something we're all very familiar with and very aware of in the current environment. As future healthcare professionals, it is important that you get vaccinated. Encourage your patients and families to discuss this issue more proactively. And so please join us in spreading the importance of this message and taking the pledge to fight flu. So if you can share the hashtag widely, we will ensure this message is disseminated from us.